Video conferencing has become so commonplace that we've grown comfortable communicating with one another through pixels on a screen. That comfort, combined with rapid advances in health monitoring technology, is fueling a new boom in telemedicine. Teladoc, a big player in providing video and telephone medical consults, had an extremely successful launch. When it went public on the stock market earlier this month, it raised more than $270 million on the first day. As Hari Srinivasan explains, telemedicine is beginning to transform the way we experience the medical system. It is the latest in our Breakthrough series on invention and innovation.
A simple ritual like gardening on a hot summer day is something Tom and Tricia Yorhammer don't take for granted anymore.
Can you use some basil?
Just a year ago, Tom had a massive stroke.
I was sitting right next door here in this room watching TV. Well, time to go to bed. So I got up and walked up the stairs, and I didn't make it. I collapsed short of the bed.
The paramedics took Tom, who was paralyzed on his left side, to nearby Mercy General Hospital in Sacramento. With blood seeping into his skull, creating enormous pressure on his brain, time was of the essence. That's when a telestroke robot was deployed to the ER.
Pretty soon this machine came toward me, and in the screen appeared a doctor. And he said, "Good evening, my name is Dr. Nee. I'm a neurologist and I'm here to examine your husband." And lo and behold, that robot turned around, went around the bed to the other side and started examining Tom. It was remarkable.
Dr. Nee was also able to remotely access CT scans and other vital data needed to quickly determine Tom's surgical needs. Mercy is one of 43 Dignity Health hospitals in the West using the telestroke robot, and there are others in use all over the U.S.
All right, so it seems like you have a left-sided weakness.
We got a demonstration from Dr. Assad Chowdhury, he's the one on the screen, and nurse Eleanor Vigilante.
It's faster for us to always use teleneurology because our physicians are not 24 hours a day in the building, and so we can actually get a physician to the bedside of a patient within 3 to 6 minutes.
And 3 to 6 minutes is the difference between what?
Every minute that we waste is potentially more brain function that's lost.
Do the same thing with your left hand if you can.
Stroke is the leading cause of serious long-term disability in the United States. Widespread use of telemedicine for stroke care is improving patient outcomes.
Okay, doctor, you can come out in.
Hoping to build on its success in hospitals, the telehealth industry is now focused on bringing more basic healthcare services directly to patients wherever they may be.
No pain there.
From the comfort of her San Francisco home, Dr. Ravina Rihal is diagnosing and treating patients for primary care ailments like sinusitis, pink eye, and bladder infections.
A patient can download the app on their mobile device, either laptop, iPhone, or tablet, and if they want to see a doctor, they just press a button and they will connect to a doctor that's licensed in their state and can see them over video.
Rihal works for Doctor on Demand.
How are you, Nassim?
One of a handful of companies connecting patients with physicians almost instantaneously.
Hi there, I'm Dr. Rihal with Doctor on Demand. Welcome.
On the day we visited, Rihal took a call from Carmen Crandall and her 11-year-old daughter, Alexandra McCamick from Naples, Florida.
If you feel here, do you feel any lumps or bumps?
Feels a little swollen in here, just a little bit.
And now I want you to bring the camera real close to your mouth and say, ah.
Can you see?
Yep, I got a good look there. It looks red, but I don't see any white patches. You can point the camera in the back of your throat and get a really good look at tonsils. It surpassed my expectations, the technology piece of it. And I think the future holds even more with all the wearable devices and all the information we're going to be able to transmit soon.
By the end of a 13-minute exam, which cost $40, Alexandra was diagnosed with viral sinusitis, and her prescriptions were sent to a nearby pharmacy electronically.
Why did you choose this service? Why not just go to a doctor that's in Naples?
You can't get an appointment. I mean, if your child is sick and you call and they say they can't see you until next week, it's pointless. Then you end up going to the emergency care clinic that costs $100 for your copay. So why not pay $40 and do it right then?
How's that going?
Beyond the convenience factor, Doctor on Demand's Chief Medical Officer, Dr. Pat Basu, says the cost savings on a large scale add up.
In the United States, there's a total of about 1.3 billion total cases where people walk in to see a doctor, of the type the doctor on demand is ideal for, you're talking about 300 to 400 million that we could treat.
You've got some residual cough.
At a rate of $40 per telemedicine visit versus an average of $1,000 for a trip to the emergency room, or about $300 for urgent care, Basu says the potential savings are enormous.
Right off the bat, that would save $25 billion to the U.S. healthcare system.
Such figures have caught the attention of insurance companies. In April, United Healthcare, the largest private insurer in the U.S., launched a partnership with 3 telemedicine companies, Now Clinic, American Well, and Doctor on Demand, to cover video-based physician visits just as it covers in-person visits.
Just review your medicine.
Health industry observers say it's the strongest sign yet that telemedicine is entering the mainstream.
Now we have over 20 million patients who have access to doctor on demand through insurance. On the government side, Medicaid and Medicare, that progression has still not fully occurred, but we are in conversations with state Medicaid agencies and national Medicare to cover this.
I'm going to tap on the tendon.
Dr. Abraham Verghese, vice chair of Stanford School of Medicine, applauds the efficiencies and cost-saving telemedicine will bring, but he's concerned about preserving the doctor-patient relationship.
A very important, I would say, ministerial function of being a physician is to be attentive, is to be present, is to listen to that story, is to locate the symptoms on the person of that patient, not on some screen, not on some lab result, but on them.
Do you ever feel like that you're missing something by not being able to touch the patient?
No. If I was taking care of heart failure and diabetes and things like that, I think I would feel really uncomfortable doing that over video. But the more common things that I'm taking care of, I feel good about what I'm doing, and I feel like I actually connect with the patients really well.
Even though Doctor on Demand chooses not to allow its home-based doctors to treat serious illnesses, outdated regulations don't necessarily prevent them from doing that. Verghese says the industry needs some clear national guidelines.
I have no doubt that we're going to learn a lot more about the blessings and pitfalls of telemedicine as more and more people start to do it. I suspect we're going to realize that it's very good for some things, and there'll be a fairly hazardous, tiny little live wire area that perhaps will develop guidelines that you don't go near.
National regulation won't be easy, as all 50 states have their own unique laws governing the practice of telemedicine. Something Krista Natoli, Associate Director of the Center for Telehealth and eHealth Law, spends her time studying.
States really focus a lot on the physician-patient relationship and physical examination. But states that are clear will say and define what an appropriate examination looks like. States that are vague do not define what appropriate means in any context. It's in the gray area where states are silent on these issues that could potentially lead to patient harm.
As policymakers determine how to define and regulate the industry, there are a growing number of patients who've experienced virtual medicine firsthand.
6-pounder.
In the years since his stroke, Tom Urhammer has fully recovered. He and his wife Tricia are grateful to be back to their normal routine. For the PBS NewsHour, I'm Hari Srinivasan in Northern California.